Item number D, I think, which is Holly, Director of Finance, will present the FY 2025 year-end budget report. Holly, I'll let you introduce yourself, and actually maybe I should just pause and ask the Access Health staff first to introduce themselves, and then you could take us into that first agenda
Mr.
item.
Chair, may I interrupt for just a brief moment? I would like just to say that this meeting is being recorded for minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website. Thank you. My apologies for the interruption.
No worries. Thank you for that announcement. So with that, I'll ask the Access Health CT staff members who are present to introduce themselves, and then we'll have Holly kick it off with item number D.
James Michelle, Access Health Connecticut.
Gina Walsh, Director of Operations, Access Health Connecticut.
Holly Zwick, Director of Finance, Access Health Connecticut. Rebecca McClear, Director of Technical Operations and Analytics, Access Health Connecticut.
Good afternoon. Susan Rich-By, Director of Legal and Governmental Affairs, Access Health Connecticut.
Good afternoon. Glenn Jurgen, Director of Human Resources, Access Health CT.
Okay, so start here, Chairman.
Yes,
Okay.
Holly, thank you.
Okay,
And then
sure, no
we'll do
problem.
the roll call at the end when we have quorum and the actions on the minutes.
Sounds good. Thank you very much. Good afternoon, everyone. Thank you, Chairman Gualtieri and members of the Finance Committee. Today, I'll be presenting the fiscal year 25 budget report, which includes the investment report, the fiscal year 26 quarter one budget outlook, and an update on the reserve fund balance. Next slide, please. Let's see here. This slide provides a summary comparison of the fiscal year 25 budgeted figures versus actual expenditures. Access Health concluded fiscal year 25 approximately $558,000 under budget. In addition, our shared budget with the Department of Social Services closed netting approximately $132,000 under budget. Next slide, please. Let's take a closer look at the revenue and expense performance for fiscal year 25. Revenue exceeded projections by approximately $236,000, largely driven by stable interest rates over the past 12 months. In addition, expenses came in $558,000 below budget, as previously noted. Key areas of savings included temporary staffing at about $122,000 in savings, some savings in contractual services, including media buying savings, IT audit savings, and 1095 staffing savings. These contractual savings were partially offset by increased spending in IT enhancements, specifically related to the development of our ICRA and SHOP platforms. Although these initiatives were originally budgeted under contractual services, our timeline necessitated reallocating funds to IT enhancements. Other administrative costs saw modest savings from our rent prepayment and staff training. And then under supplies and travel, we were able to save with our continued cost-conscious efforts, yielding additional savings. Next slide, please, Marcy. This slide outlines the projects that were initiated and funded during fiscal year 25, but not completed by fiscal year end. The table provides a detailed breakdown of these carry forward initiatives. As of quarter one in fiscal year 26, there's a $2.6 million remaining in the carry forward account. All listed projects are scheduled for completion within fiscal year 26, and we remain confident they will be delivered on time and within budget. Are there any questions at this point? Next slide, please.
Yeah, you could. Thank
you. Mr. Chair, I just would like to mention that we do have a quorum. We had additional members joining us. So how would you like to proceed? Should we vote on should I do the roll call for the attendance at this point?
Yes, I think that's best. Let's return to the top of the agenda, take the attendance, and then we'll proceed with approval of the minutes and then continue with Holly. Holly, I'm sorry to disrupt you for a few minutes, but I want to make sure that the full Finance Board has a chance of the benefit of your presentation.
Oh, no problem at all. Thank you.
Roll call for attendance. Claudio Gualtieri.
Here.
Thank you. Chair Matthew Brackman.
Here, sorry I was late.
Thank you. Thomas McNeil.
Here.
Thank you. Deputy Commissioner Peter Hadler from DSS.
Here.
Thank you. And Commissioner Manisha Sutani from DPH. Thank you. Mr. Chair, we received no public comments.
Thank you. So then we can proceed with review and approval of the meeting minutes from April 10th, our last regular meeting date. Do I have a motion to entertain approval of the minutes?
Tom McNeil, so moved.
Thank you, Tom. Seconded.
Second, Matt Brackman.
Thank you.
Mr.
Any
Chair,
discussion?
my apologies. The slide is wrong. There should be April 10th, 2025 meeting minutes. My apologies for that.
No worries. I think I verbalized it correctly because it's correct on my notes. But yes, thank you for noting that correction on the slides. So with that, we're entertaining a motion to approve the April 10th, 2025 regular meeting minutes. It's been moved and seconded. Any additions, edits, questions on the meeting minutes as drafted? Seeing none, Mr. Administrator, can we call the roll for approval of those minutes?
Yes, Mr. Chair, Claudio Gualtieri,
Yes?
Matthew Brackman,
Yes.
Thomas McNeil,
Yes.
Peter Hadler,
Yes.
and Commissioner Manisha Sutani. Thank you. We can go back to the
Perfect. And now we'll return. Holly, if you can continue with taking us through the presentation of the FY25 year-end budget report.
Sure, no problem at all. So we were on CIP. I want to welcome the two other members of the committee who joined us. And if you want a synopsis of the fiscal year 25 actual expenditures, feel free to reach out at any time. But let's see, I think we were on the next slide, Marcin, to talk about, yes, this brings us to the investment report, which we need to revisit every 6 months. To briefly recap, the objective for the Access Health CT Exchange Fund is to obtain the maximum rate of return while preserving the principal and providing immediate liquidity. Access Health invests in the State of Connecticut Treasurer Short-Term Investment Fund, or STIF. This account is available for use by the state's funds and agencies, and state statutes authorize these pooled investment funds to be invested in U.S. government and agency obligations. These investment pools are under the control of the state treasurer. Next slide, please. The total interest earned on the STIF account for fiscal year 25 is approximately $1.3 million, which is an average of over $108,000 monthly. It's important to note that the Access Health CT's investment portfolio is in compliance with our investment policy, and we can meet our expenditure requirements for the next 9 months. To enhance the security of our financial assets, we have implemented additional safeguards, including a sweep account and positive pay fraud protection. The income generated through the sweep account effectively offsets the associated costs of these protective measures. Any questions on investment? And next slide, please. Thank you. The fiscal year 25 quarter one budget, fiscal year 26 quarter one budget is focused on investments in IT, cybersecurity, and health disparities to aid in supporting our mission of decreasing the number of uninsured residents, improving the quality of healthcare, and reducing health disparities. Next slide, please. This slide presents a very high-level summary of the fiscal year 26 year-to-date budget versus actuals as of the end of quarter one, so as of September 30th, 2025. The Access Health CT budget is currently tracking approximately $402,000 under budget. Similarly, the DSS shared cost budget reflects a favorable variance of about $413,000. I'll provide further detail on these variances in the next slide. Here we take a closer look at the Q1 budget versus actuals. As noted, income has exceeded projections by nearly $160,000, driven by stable interest rates and carrier assessment prepayments. Additionally, marketplace assessment revenues are approximately $23,500 over budget, primarily due to adjustments related to dental amendments. On the expenditure side, several variances are attributable to the timing of project execution and invoicing. Some initiatives commenced earlier or later than originally forecasted, but we anticipate they will align with the budget expectations by year end. Next slide, please. At this point, we are not anticipating any change to the current proposed budget as of the Q1 of fiscal year 26. Slide, please.
Hold on, Mr. Chairman,
Oh,
just and the committee, just gonna give you a heads up. We are looking at some adjustments to the budget. We're not ready to do anything yet with respect to what's going on in DC, impact to brokers, what's going on with the brokers. So we are putting together, I think we sent some note to the board about some of the, we may have to do something with brokers that may require us to spend more money than originally planned. So we have it all worked out already, but once we know exactly where things are, well, especially with what's going on in DC, then we'll come back to the board, to the finance committee, with some exact numbers, projected numbers of what we may need to pull out of reserves to support the effort, making sure folks who are applying for health insurance through the exchange have the support they need from our broker community. Just going to give you a heads up that that's in the works. I think we sent the note to the board last week outlining our plan and strategy to address some of the gaps that may have been created by one of our insurance carriers choosing to pay $1 for commission for new business commissions.
Thank you, James. And I appreciate you being forward thinking in that regard, because we all at the board level were concerned. Obviously, we're adding a lot of level of complexity to shopping the exchange this year, with some uncertainty about the enhanced credits and other changes that happened, both with a market rule that was implemented this summer and then HR 1. And I think it's prudent that if some of the commissions may be lower than we typically see for brokers doing that work of counseling people and finding the right plan, that Access Health step up. And I thought that was a good idea to have some employees of Access Health essentially be independent broker functions to help people navigate these changes. So look forward to supporting whatever may be needed to make the consumer experience as successful as possible. Thank you.
The other addition is going to be more printing costs because of all the notices we are sending out. More than we had originally budgeted. So, but we'll keep you posted, and anything we could squeeze out of the operating budget without going to the board, we will do that. But if we need to, we'll come back to the board. Thank you.
Appreciate
Thank
it.
you for that, James. Appreciate it. Let's see. Okay. This slide provides a comprehensive view of the full fiscal year 26 budget following Q1. Currently, no changes are expected. Again, if we will return to the board and finance committee to seek approval for any revisions. Okay, next slide, please. In addition, we are not anticipating any changes to the shared cost budget with DSS at this time. Okay. Are there any questions up to this moment? Okay.
That's good. Thank you, Holly.
Thank you. To conclude, I'd like to provide a brief update on the reserve fund. As of June 30th, 2025, the reserve fund balance stood at approximately $24.7 million. Once we adjust down for the fiscal year 26 assessment prepayments, which total roughly $1.35 million, and account for the $3.1 million in committed projects that we spoke about a few slides earlier, our projected fiscal year 26 year-end balance totals approximately $20.2 million. Based on the current fiscal year 26 budget, this equates to approximately 5.8 months of operating funding coverage. And just again, in conclusion, I'd like to point out that even though our reserves have increased since last year, expenses have increased at a higher rate. And I can end there, Mr. Chairman, and answer any questions if needed.
Thank you, Holly. And just for awareness and reminding the board, that 5.8 months is roughly in line with the board's adopted recommendation of about 6 to 9 months. So we were sort of looking at 6 months being a minimum operating supply. So we're roughly in line with having the targeted goal for reserves on hand, correct?
Yes, we are. And thank you for pointing that out. Appreciate
Perfect. Thank you.
it. Mhm.
Any other questions from Finance Committee members? Seeing none, we can move on to the next item, which would be a vote. So this is the vote for adopting the fiscal year 2026 quarter one budget report as presented by Holly and the Access Health team here. Do I have a motion?
So moved.
Thank you. Moved by Matthew Brockman. Do I have a second?
Second.
Thank
Tom
you.
McNeil.
Tom McNeil seconded. The motion is properly moved and seconded. Any further discussion on the adoption of the Q1 budget reserves report? Seeing none, I'll ask for a roll call vote.
Claudio Gualtieri,
Yes?
Matthew Brockman,
Yes.
Thomas McNeil,
Yes.
Peter Hadler,
Yes.
and Manisha Tutani. Thank you.
With that vote, I think the only item left is the motion for adjournment, which I'll entertain now.
I'll make
So
that
moved.
motion.
No, second.
Thank you. The motion is moved and seconded. Marcin, can you please take a roll call for adjournment
Claudio
on our?
Gualtieri. Mhm.
Yes?
Thank you. Matthew Brockman,
Yes.
Thomas McNeil,
Yes.
Peter Hadler,
Yes.
and Manisha Tutani. Thank
All
you.
right. Thank you
Thank
all.
you.
We are adjourned.
Thank you all.
2:19. Thank you.
Thank you all.
Bye-bye.
Thank you, everyone.
Bye-bye.
Thanks.